Good morning. Today is an important day for many Islanders and young children as they go back to school either today or tomorrow. And I think it's also an important step for Prince Edward Island that we're in a position that children are able to go back to school in the middle of this global pandemic. And an important step as well as we all learn to live with COVID. Today, I can confirm there are 9 active cases of COVID-19 in the province. 7 of these cases were reported over the last few days, and there are 2 new cases to report this morning. As was reported over the last few days, we've had a number of new cases of COVID-19, and all are related to international travel. So to recap the recent cases, 5 are essential workers who do not work in healthcare. They self-isolated immediately upon arrival. 4 are males, 2 in their 20s and 2 in their 30s, and 1 is a female in her 40s. These 5 individuals were asymptomatic and tested positive as part of the routine public health follow-up. The test results for another essential worker are pending, with results expected later today. 1 male is in his late teens who arrived in PEI late August and also self-isolated immediately upon arrival. He developed symptoms of COVID-19 and was tested. He continues to have mild symptoms and is doing well. 2 young children under the age of 10 and a female in her 30s, all part of the same family, are also positive. This family also self-isolated upon arrival. These 3 individuals were asymptomatic and tested as part of routine testing. The 9 individuals who tested positive in the past week bring the total COVID-19 case count in PEI since the pandemic began to 53. 44 of our cases are now recovered. Fortunately, in PEI, there have been no hospitalizations or deaths related to the pandemic. The World Health Organization estimates that 80% of COVID-19 cases are mild, 15% severe, and 5% critical. Given these projections, PEI has been very fortunate to date in not having anyone with severe symptoms requiring intensive care. Given the 9 new cases respected the need to self-isolate and had very few contacts, the risk of transmission to Islanders remains low. The epidemiology in PEI highlights that we continue to be at risk of importation of COVID-19. Specifically, there is risk of importation of the virus from other countries, with many of our cases related to international travel. Although I wish we did not have 9 new cases in the last week, I am reassured that our existing systems and protocols are effective in limiting transmission of COVID-19. I'm confident that these cases have been contained as a result of the testing, self-isolation, and contact tracing. The 9 new cases all respected the need to self-isolate, and they had few, if any, contacts. And it's a reminder, self-isolation is an effective means of breaking the chain of transmission of COVID-19. And it's important that individuals who are required to self-isolate do, in fact, limit their contact with others. As I mentioned earlier, today is an exciting day for many island families with the beginning of the school year, both today and tomorrow. And I know my 4 children went off to school today. Whether it's the first day of kindergarten, junior high, high school, or university, the beginning of a new school year signals anticipation, change, and transition. And this school year will be like no other we have seen, and it's likely to be a challenging one for parents, students, teachers, and staff. And families with young children have been disproportionately affected by COVID-19, with school closures, child care centers, and access to friends, parks, and recreational activities initially restricted. And we know COVID-19 has impacted the mental and physical health of some of our children, and the pandemic continues to be a stressful time for families. It's important that schools be supported in their efforts to provide a full year of in-class learning for students. Someone mentioned to me this morning that COVID-19 is not waiting in the hallways of our schools, but that the greatest risk for our students is in our community. Our actions over the next few weeks will impact island children. And so the actions that we take as islanders can support our children and the school system to keep community transmission of COVID-19 low. So please practice physical distancing, wash your hands frequently, keep our circle of contacts small, stay home if you're not feeling well, and wear a mask if in an indoor space. We've carefully increased the size of gatherings with 3 groups of 50 people allowed, but an operational plan is required. Research does show a clear relationship between gathering size and risk of transmission of COVID-19. The lowest risk of transmission is associated with individuals who maintain small, closed community networks where people interact with a chosen group of others with limited interaction outside their network. In other jurisdictions, higher transmission events have been attributed to gathering with a larger number of close and sustained contacts. So larger gatherings are associated with the largest outbreaks. And of particular concern are activities associated with entertainment, leisure, dining, sports and fitness, parties and bars and nightclubs. This research continues to highlight the necessity of keeping our circle of contacts small. We need to ask ourselves if we are comfortable attending gatherings where we do not know most of the people who will be attending, and if not, we may want to consider not attending. I'm very pleased that islanders who are able to access drive-through and drop-in COVID-19 testing across the province. I know Marion will speak to that. A big thanks to our colleagues at Health PI and Island EMS for being diligent and working hard to improve the access for islanders. Islanders also began accessing their negative COVID-19 test results on September 3rd, and the early reviews of the COVID test results are positive, with over 1,500 individuals accessing the site in the last 6 days. Last week, we discussed the reality that living with COVID-19 is a long-term commitment, and we realize this virus will be with us for the foreseeable future. Prevention measures are not absolute. The risk of transmission of COVID-19 cannot be reduced to 0, and we do have to learn to live with COVID-19. We are able to safely enjoy most of our regular activities here in PI with some modifications. We can go to a movie, we can enjoy our parks, families can access childcare, our loved ones in long-term care can see their families, and we can receive elective and emergency health services. We can travel within Atlantic Canada without having to self-isolate. Our children can go to schools. Sport and recreational activities have resumed, and the list goes on. PEI has taken some large steps in reopening businesses and organizations towards our new normal. And the easing of measures has been implemented successfully with no widespread community spread of COVID-19 in our province. Decisions will continue to be made based on the local and national epidemiology of COVID-19 and the best available evidence. I just want to highlight a couple of numbers that over the Labor Day weekend, over 10,000 vehicles came to PEI through the points of entry. And thank you to our partners in highway safety, transportation enforcement, and the CPHO staff for their hard work, making sure that so many people were able to travel to our beautiful province for the long weekend. In every case, the individuals coming to the province were screened and identified and checked for symptoms or asked about symptoms. We also have had to date a total of 1,652 COVID inspections, which have been completed. A total of 28,500 COVID-19 tests have been completed in PEI, including 1,500 tests in the last week. And in terms of COVID testing per capita, PEI still ranks second in Canada, having conducted 188 tests per 1,000 population compared to an average of 155 per 1,000 population in Canada. As I mentioned last week, we've been on this journey together in PEI during the global pandemic. We have all been impacted, and thankfully not as impacted as other jurisdictions that have experienced devastating illness and deaths. As the pandemic evolves, we continue to learn. We've learned a great deal about ourselves, our loved ones, and the resilience and goodness of our communities. We've learned how challenging these times can be, yet how much caring we have for each other, including people we may not even know. We will continue to learn about the virus and make the best decisions we can, given the information available. Together with our team and government and our community, we will continue to help protect the health of Islanders. Please be patient. Please be kind. Thank you very much. I'll turn over to-
Thank you, Dr. Morrison. I'm able to provide an update on access to testing for COVID-19 as it continues to be an important part of the response to this virus, and we're expanding testing across the island. COVID-19 testing samples are collected by trained health PEI staff or Island EMS paramedics across PEI. This week, we are opening new testing clinics to provide quick access to testing for Islanders. Swabs received or retrieved at the testing clinics are processed at the health PEI laboratories, and results are generally provided within 72 hours. Negative test results are now available through the Negative Test online website, as Dr. Morrison mentioned, and people with a health PEI or PEI health card can start looking on the website up to as soon as 24 hours after their swab has been collected. Results may be only posted up to 72 hours, but after 24 hours after your swab has been collected, you can start looking on that website. If people have questions regarding symptoms that are continuing even after a negative test result, we would encourage them to call the 1-800 number or 1-833 line to receive any information related to their personal situation. There are two types of testing clinics now, scheduled and drop-in clinics. Scheduled clinics will continue to be offered in Charlottetown at the Eastlink Center and in Summerside at our Slemon Park location. To access this scheduled test, people must call their family doctor or nurse practitioner or call 811 for a referral for a test if it's required. They'll be given a scheduled time to attend and instructions to follow when they arrive. Our no appointment drop-in clinics, our testing sites, are now going to be available in locations across PEI to provide increased timely access for testing. Testing at our drop-in locations is offered on a first-come, first-served basis at these clinics with no referral necessary. At this time, these clinics will be prioritizing testing for symptomatic children, any symptomatic household members, as well as essential workers who require frequent testing, and if they have any symptomatic household members. The drop-in clinic locations and schedule are as follows, and these will be available on the website for the government website as well today. They will be starting tomorrow in O'Leary at a testing clinic located in the Community Hospital O'Leary building. This site will run on Mondays from 1 p.m. to 4 p.m., on Wednesdays and Fridays from 8 a.m. to 12 p.m. The Summerside Testing Clinic at Slemon Park will add a drop-in location which will run on Sundays, Tuesdays, and Thursdays from 8 a.m. to 12 p.m. Our Borden drop-in clinic is located at 20 Dickey Road, and it will operate on Monday and Wednesday from 8 a.m. to 12 p.m. and on Saturday at 8 a.m. to 11 a.m. The Charlottetown location for drop-ins is at the Eastlink Center in the parking lot, and it runs Monday through Friday, 8 a.m. to 4 p.m., as well as Saturday afternoons at 1 p.m. to 4 p.m. We've added an additional testing clinic in Montague, and it's located in the Health Center parking lot, and it will run Monday, Wednesday, and Friday from 8 a.m. to 12 p.m. Those clinics operating on Wednesdays will start tomorrow. When you arrive at one of the drop-in testing sites, you must remain in your vehicle, and you'll be greeted and directed by security personnel as to where to go in your vehicle and how to access the site for your swabbing. Please remember to bring your health card with you. We know that testing guidelines and needs will change as they have changed as we continue to respond to COVID-19. Changes to the testing clinics will be made as necessary and updates will be provided to the public. The new clinics that are opening this week for drop-in testing will help provide increased access as needed for school-age children in particular to help support the reopening of our schools. We are making plans to move our Eastlink location to an alternate location on Park Street in Charlottetown at the former government garage building, which will be called our Park Street COVID Clinic. Both the swabbing service and our cough and fever clinic will be moving to this location. More information on the service access at the new location will be provided as it becomes available, but plans are being made to move this service at the end of September. To provide an update on testing and just to add to Dr. Morrison's comments, we completed or collected 220 swabs at our Charlottetown, Summerside, and Borden testing clinics yesterday. Please remember to attend your appointments and seek care as needed, and bring and wear a mask or face covering to help protect everyone when you do. I want to say thank you again to our team within Health PEI, our partners with Island EMS and Transportation and Infrastructure, for all their support in us in all of our services as we continue to expand testing sites and swabbing clinics. I also want to offer a speedy recovery to all of those new cases that have been identified in the past week, and say thank you to those Islanders and visitors who continue to follow the direction for our public health measures so that we can all continue to progress safely through this pandemic. Thank you.
Thank you, Marion. And we'll open it up for questions.
Sue Neepy, The Guardian.
Hi, good afternoon to you both. Excuse me. First question to Dr. Morrison. You noted the 9 current active cases. I note going back the last month, there's 14 cases that have been described kind of in a similar way as being essential workers not in healthcare related to international travel. So I'm wondering first whether all the current active cases are workers who are in the same industry, and if all the 14 cases that have been reported since August 12th of essential workers not in healthcare related to international travel are all within the same industry.
Hi, Stu. So you're right. We've been identifying essential workers and really just saying that they're not in the healthcare field. And so in terms of the same industry, I mean, essential workers, we haven't given places of employment, and I don't think we need to give place of employment. There are times when we identified 2 or 3 would be in the same industry, but and that continues to be the case. I think the important thing here, Stu, is that we have essential workers coming in. They're related to essential travel, and they've been self-isolating, and really highlighting the risk of international travel, in particular in these last number of cases, the importance of self-isolation, and that our system is trying to manage those essential workers coming in.
Okay. Now, I guess of the 9 current active cases, looking, I guess, at those that were particularly essential workers, were they coming in from the United States or an international country that is not the United States?
The last cases of essential workers did not come from the United States. They were other international.
Okay. Thank you.
Welcome.
Nicole Williams, CBC.
Hi, Dr. Morrison and Ms. Dowling. I'm wondering if you can speak to Why are we seeing so many new cases in the last week or so? Is it just coincidence? Are they, are a lot of them connected in any way? And I'm wondering if you can also tell me how many additional people have had to be tested and how many people are connected with these new cases in the last week.
Hi, Nicole. So I think we've had, because I've been in self-isolation, the contacts have been very minimal. We have really only a handful of people who needed to be tested in addition, but certainly close contacts have been tested. We have, I think you mentioned there was, I think there were different parts of your question, but we have had some essential workers. We mentioned the family, that there were 3 in one family, and which included the 2 children, and then another person who's not an essential worker, but all of them related to international travel. So, of course, when a case is identified, the close contacts are tested. Close contacts also remain in self-isolation as well as the contacts. So they are followed on a daily basis, both the cases and the close contacts, by public health nursing until they're cleared. And that has been the case since the beginning of the pandemic, and it will continue. I think it's just coincidence we have a number of these cases in the last week, and with people coming from international travel. So I think it's, as I mentioned, it's not something that we like to see, but we also know that we're in a situation where they've been self-isolating, and that is really important and reassuring.
Thank you. And I'd also just like to ask about the new drop-in drive-through testing. And I know that this is, supposed to be unscheduled, but you're saying it's only for asymptomatic people. I'm just wondering, why not have it open 5 days a week, especially during school hours? I kind of thought that was the whole point of this new system, was for parents and for whoever to be able to take their kids right from school to testing and get those results.
Hi, Nicole. I'll just answer a little bit. I want to make sure I've been clear that it is for symptomatic individuals to be able to come and drop into the testing. And so we've added these locations. What we had previously for drop-in testing was only in Charlottetown at the Eastlink parking lot. So starting tomorrow, we will have testing locations for that purpose of drop-in testing for anyone with symptoms. And we are absolutely prioritizing children who have symptoms to come and be tested. And they're being added now in Summerside, in O'Leary, in Borden, as well as Montague. So I'm sure you can understand the challenge with getting staffing and everything up and running. And of course, we've been planning for this for a while, but also managing the ability to have people receive their test results in a timely way, and coordinating that with our laboratory staff and where the staff runs are. So as you collect the swabs at a location, it needs to be transported and the test completed in an appropriate fashion as well. So it is for symptomatic children or individuals, any household members as well with symptoms, who can come and show up at these locations. And with our scheduling offset a little bit, there is access every day of the week somewhere in the province for drop-in testing.
Thank you. Do you think the hope is to get all of these sites open 5 days a week? Is that a goal you're working towards?
I think we will have to see and monitor how the need arises, and we've adjusted and adapted as we've needed to try and decrease any wait time for testing. And so we'll see how the season arrives with our respiratory illness and how we need to adjust the times. We still know as well that we have some families who appreciate being able to schedule an appointment and have that testing done, and some of our essential workers who also like to have that particularly if they're needing repeat testing with their work schedules. So we're trying to maintain a little bit of both sides of that service for people.
Thank you.
Julien Lecacheur, Radio-Canada.
Bonjour, Dr Morrison. Vous annoncez aujourd'hui 2 nouveaux cas. On est à 9, si je ne me trompe pas, dans la dernière semaine. Est-ce que, Dr Morrison, ça va devenir une nouvelle normalité? Est-ce que vous vous attendez dans les prochaines semaines à annoncer maintenant régulièrement des nouveaux cas de personnes arrivant à l'international?
Bonjour. J'espère que non. J'espère que ça va pas continuer, mais en même temps, on sait qu'on doit s'habituer un peu au COVID-19 ici à l'île du Prince-Édouard. J'espère que si je dois annoncer les cas dans les semaines qui suivent, c'est les cas qui sont liés au voyage et puis ils sont les cas qui s'isolent quand il faut. Et si ça continue comme ça, je suis plus rassurée. Mais on a fait beaucoup de temps sans plusieurs cas, alors c'est un plus grand nombre dans quelques jours. Mais j'espère que ça ne va pas continuer avec ces nombres, mais on va voir.
Est-ce qu'avec ces nouveaux cas qui arrivent maintenant assez régulièrement, et même si les personnes respectent les consignes et s'isolent, est-ce que ça change quelque chose sur la possibilité de rendre obligatoire le port des masques à l'intérieur de tous les lieux à l'île du Prince-Édouard, où vous maintenez votre position, les masques ne seront pas obligatoires?
Les masques, la position des masques, ça continue. On parle souvent avec l'équipe dans mon bureau. À ce moment, on n'a pas d'indication qu'on a des transmissions communautaires. Alors, on fait de l'éducation, on encourage, on fait des recommandations à propos de porter les masques, mais et puis si on voit quelque chose qui change dans cette façon, on va les faire obligatoires. Mais à ce moment, on regarde l'épidémiologie ici à l'île du Prince-Édouard et puis on regarde ça chaque jour.
Merci beaucoup.
Catherine Fleury, La Voix acadienne.
Oui, bonjour, Dr. Morrison. Je voulais savoir, dans le fond, comme tous ces nouveaux cas sont des cas qui viennent de voyage, dans le fond, est-ce que vous pensez resserrer les mesures pour pouvoir rentrer à l'île du Prince-Édouard?
C'est pas vraiment, c'est pas mon décision. C'est des décisions vraiment du gouvernement fédéral que les gens rentrent pour des raisons. Alors, pour moi, c'est de s'assurer que quand ils rentrent dehors du pays, qui sont isolés pendant 2 semaines pour protéger leur famille et la communauté. Alors, c'est pas à moi de décider qu'il entre au pays ou non, mais s'il vient à l'île du Prince-Édouard, on veut s'assurer qu'il protège eux-mêmes, mais aussi les autres insulaires.
Parfait, merci.
Carrie Campbell, CBC.
Good morning, folks. Thanks for taking our questions. I know, Dr. Morrison, you mentioned that I think you said you have 4 children starting school today. I'm just kind of curious, as a parent, what concerns, if any, do you have about what they're doing right now? And kind of curious what discussions you guys had. And Ms. Dowling, I don't know your situation, if you have more to add on that, but I'd be happy to hear that as well.
Yes, I know Marion has a couple of children actually going to the same school as some of mine. So thank you, Carrie. I think I actually am excited that it's been a very long March break, as has been referenced. It's and I think we're in a really good position. I've said this publicly over the last couple of weeks. We're in a good position in Prince Edward Island, given our epidemiology, our cases related to travel, who've been self-isolating, that this is a good position to be in to go back to school. I think, yes, it will look different, and it will be a challenge for our staff, teachers, and students and families. But I think in the middle of a global pandemic, Prince Edward Island is going back to full-time in-class learning at this point in time. I hope that as a province we will be able to continue that for the year, and that the measures we're putting in place will try to minimize any risk of the transmission of illness, but also be able to break any transmission of virus if it does get into our school. I also know that in the whole country, just over 8% of the cases have been in children. So it's a small percentage of our cases in the country. I also know that the virus is unlikely to be spread from young child to young child. It's more likely in the school setting. It'd be more likely from a close contact in the community or a parent. So I think those are the things that I certainly have been thinking about, but it's different to see our children going off, making sure that they don't just have their lunches and their backpacks and books, but that they also have a mask, and they think about washing their hands, and that they're well and feeling well before they go to school. I think those are all things that we're certainly more conscious of this year. Yeah.
Hi, Carrie. I do have 2 young girls who are very excited to go to school this morning. They went off on the bus with their masks and had another one in their bag to put on if that one gets soiled. I think they had some of the similar concerns, which were mostly circulating around, were friends going to be in their class, and how are they going to be able to interact at recess and within their cohort, and what would that look like? So lots of questions that they will have answered today. I would just agree with the comments Dr. Morrison has made about our comfort level with the province and how people in our community have been really following the guidance and doing as much as they can to keep everyone safe so that our children feel safer in going. I know the staff and the teachers and administrators in the school system have been working hard, and we have confidence in their abilities to do their best, and it is a good time to go back to school. They're excited to be in class and learning again, and they had some of the similar excitement as they've had other years. Thanks for asking.
Thank you both for that. And Dr. Morrison, I'll get you to put your CPHO hat back on maybe for a moment. I know one of the measures that seems to have been identified across the country to try to reduce the risk is to have smaller class sizes. And kind of early on in the discussions, the way we heard it from the minister, it sounded like there was some back and forth going on between the department and your office in terms of what the guidelines or directive might be regarding class sizes. I'm just curious if you can provide any insight as to, what sort of guidance you gave, whether there was a hard limit on that or not, and how that translated into what we see now, and also if this might be an area where you might look to maybe make some changes once we get into this, once we find out how big some of the classes are, or if there's anywhere else you're looking as we get started to maybe try to tweak things here.
Hi, Carrie. And so it's been a really good relationship working with the Public Schools Branch, Commission, and Department. In terms of the class sizes, I think, of course, having smaller class sizes in order to make sure that you had as much physical distancing as possible and what was reasonable in certain settings was really the guidance that we would have given out of our office. And I think the department and the school branch really said that, we have limited number of classes, and we have sort of physical infrastructure, and we are also conscious of how many teachers we have and how many more would be needed. And so some of those decisions, the decisions around the class sizes was left up to education, and but they knew that we would certainly want to keep them as small as possible, and in terms of making sure that the public health measures were kept in place. So I think we will look at what happens in the weeks and months ahead, and I hope all goes well. I think one of the things that we certainly talked about was the importance of cohorts with the school system, and I think that's why the operational plans that came in all address that cohort issue so that they would minimize the numbers of students that would be interacting with others. And that would be to limit the impact and the transmission if a COVID case was identified in the school.
Thank you.
So I think that's it. Thank you very much.